Everyone, and welcome to Nursing to Do and to Be, your one-stop shop for everything nursing. Today we're going to talk about a very important disease that affects people more than necessary. According to research in the United States alone, it affects more than 800,000 people every year. 800,000 people every year. So you can imagine the impact of that disease all around the world if it affects more than 800,000 people in the United States. It's very critical for us to understand this disease, how it happens, what we can do in our part to prevent it, and even if we contract the disease, how we can live with it and manage it so it doesn't incapacitate us. So listen to me and you may learn a thing or two. So the disease we in question is myocardial infarction, heart attack. This occurs when there's a problem with circulation of blood flow to the heart muscles. As we all know, every organ in the body depends on blood supply for oxygen, nutrients, electrolytes, water, and any other thing that it needs. So the heart as an organ also needs blood flow to its muscles to be able to function effectively. And when that doesn't happen or it's not efficient, then there is a problem, and that results in myocardial infarction or heart attack. The heart is surrounded by coronary arteries. Those are arteries that are dedicated and specialized to supply blood to the heart. And when one of these 5 things that I'll be mentioning happens to those arteries, then the heart is attacked. The first one is ischemia, which simply means less or little blood flow to the heart. When this happens, the heart doesn't get the blood amount it needs to efficiently carry out its function. So then it will make it unhappy. And as we know, when there is no blood to a part of our body, or when there is little blood and it's inefficient to supply the needs of our body, that part of the body dies. So heart attack is simply the lack of blood flow to the heart muscles and the muscle dying. Ischemia is when less or very little blood gets to that part of the heart. Okay, so the next is mechanical issue. The heart has structures implanted within it to carry out its electrical activities, to coordinate all its activities. It has structures embedded in it, and those are mechanical structures. And when there's a problem with one of those structures, it throws the heart out of sync, and it can lead to inefficient blood flow to the heart muscles. The next is also an arrhythmia, talking about electrical impulses generated by the heart. When there's a problem with that sequence of events to generate a regular or normal heartbeat, it becomes an arrhythmia, which is an irregular beating and relaxing of the heart. And that can also cause inefficient blood supply to the heart through the coronary arteries. And then we do have an embolic condition, which simply means a clot formation within the coronary arteries, preventing blood flow to the muscles where it's needed for it to work efficiently. Then we have conditions where the heart also could be inflamed or be infected, and therefore affecting the functioning of the heart as an organ, and subsequently not allowing enough blood supply to the muscles of the heart for it to work efficiently as an organ. So when there is an ischemia, which is less or little blood flow to the heart as a muscle, when there is an arrhythmia, which is a change in the beating of the heart, the lap dub that we hear when we listen to our heart rate, when there is a change, it could cause that. Or a mechanical problem, which is the structures of the heart, when there is a problem with it, it could also cause inefficient blood flow to the muscles of the heart, or it could be an embolic, which is a clot formation within the arteries of the heart, or an infection or inflammation. So for us to understand it, we need to dig deeper to understand the root cause of the heart attack, to be able to prevent it from occurring, and to be able to understand the treatment of choice for that particular heart attack. Okay, so I hope you've understood my explanation, and I'll be coming your way again with more details regarding risk factors, the types of heart attacks, and what we can do to prevent it or manage it. Thank you for watching. God bless you.